Good evening, everyone. We have called this press conference today to inform members of the public that just 2 hours ago, the first diagnosed cases of COVID-19 have been confirmed in Bermuda. The government of Bermuda understands that this news will leave many residents concerned and with questions. We understand these concerns and want to reassure you that we are taking this development extremely seriously. The situation is still evolving, so we will share with you the information that we have now and additional details as soon as we have them. Right now, we know that 2 residents are confirmed to have COVID-19. The patients had recently traveled from the United States and the United Kingdom respectively and became ill a few days after returning to the island. The 2 cases are unconnected. Both individuals who were identified early are recovering and did not require hospitalization. They are presently isolated and have been isolated since they became symptomatic. The Ministry of Health is working closely with other ministries across the government to rapidly investigate this situation and to help prevent the spread of COVID-19. Our chief concern is how many people had close contact with the individuals once symptoms developed. In that regard, we are currently taking the following actions: making sure the individuals are receiving appropriate treatment and remain isolated, and interviewing the individuals in close contacts, such as family members, to obtain detailed information on their travel history and exposures, and then monitoring the family members to see if they become ill. Currently, they are self-quarantined, and this may require collecting and testing specimens from those individuals. I want to reassure the public that the government has been actively preparing for this eventuality, like as part of international health regulations. Thankfully, we will have the ability to screen for COVID-19 on island tomorrow, which will aid us in controlling any spread of this virus. The COVID-19 EMO will be meeting at 7 p.m. tonight to consider any additional social distancing measures that may be put into place. I want to encourage everyone in Bermuda to continue to protect themselves to prevent the spread of COVID-19 by following good hand hygiene and good etiquette. This includes washing your hands frequently with an alcohol-based hand sanitizer or soap and warm water, maintaining social distancing, maintaining at least 3 feet distance between yourself and other people, particularly those who are coughing, sneezing, and have a fever. Avoid touching your eyes, nose, and mouth. And if you have a fever, cough, or difficulty breathing, seek medical care early. Call ahead and tell your healthcare provider of your symptoms and travel history. And most importantly, if you have returned to the island, it is urgent that guest workers and Bermudians alike keep yourself quarantined. As this is an evolving situation, I am committed to keeping you updated as we work together to reduce the spread of COVID-19 in Bermuda. In closing, I want to reassure the public that ensuring the health of our citizens is our top priority. The government website, coronavirus.gov.bm, will be updated this evening to reflect the 2 imported COVID-19 cases. That is all for now, and I'm happy to take any questions from the media.
Anybody have questions?
Thank you, sir. In no particular order, there was talk of 800 test kits on the way to the island. We wanted to check if the figure was correct, and if so, when they would be getting here.
What I'm going to say is I cannot confirm the actual amount that are en route. What I can confirm is that there are 90 on island currently.
Thank you. And there was reference over the weekend to enforcing self-quarantining. We just wanted to check. There was talk of legislation that was coming to the House on Monday. If we were correct in reporting that, I guess when it comes to self-quarantine, if it's mandatory, what powers we have to enforce that, or is it kind of a honor code, as it were?
We'll be giving further updates after the 7 o'clock EMO meeting, which is taking place. There were changes to legislation which were done on Monday, which were put into effect. and the Minister of Health will be issuing a public health emergency order that will compel penalties for people who break self-quarantine.
Premier, these individuals, they are self-quarantined at home or?
They did not require hospitalization.
Premier, can you say what flights they came in on from the UK or the US?
We are not going to be giving any of those details at this particular point in time. I can assure you that the epidemiologists, they are working right now. There was contact tracing that was done prior to this announcement, as is done for any persons, and they are prepared for that particular eventuality. I'm certain that there will be further announcements and discussions on these measures. The public health team, the public health emergency response team, has been preparing for this. Dr. Pete Ball and her team have been working. They have a plan of action, and now that plan of action has sprung into effect. And we will continue to give further updates. The most important thing is for persons to remain calm. That is what's important. We are going to continue the process of which we've had thus far, and I'm certain that we will be able to protect the community, and we're in a better place now than we were 2 weeks ago.
Premier, can I ask maybe for the health minister or Dr. People, in the US now, they're finding that the capacity of the healthcare system is getting overloaded as it was in Italy. And some of the physicians are suggesting that they go off-label with the ventilators. They're finding that with some modification kits, they can ventilate 3 people on 1 ventilator. It's off-label, but would that be something that Bermuda could look at to expand our capability to treat more patients should the need arise?
Here's what I'm going to say. I'm going to say that the Public Health Emergency Response Team has been working with BHB, et cetera. They have upped their capacity. They are ready. Our job is to make sure that we never get to that point, and I'm confident with the public health measures of which we're taking that we will not get to that point. However, the COVID-19 EMO will be meeting at 7 p.m. to discuss any further measures under the advice of the Chief Medical Officer that will need to be taken.